Okay, can you all hear me and see my screen?
Yep, thanks,
Yeah,
Mark.
perfect. Thank you. Excellent. So, hi everybody, and welcome. Obviously, my name is Mark from Ardens. I'm here to go through the cancer resources that we have available on SystmOne. During this little presentation, I've got a patient record open, as you can see in SystmOne. It's just a test patient which I'm going to dip in and out of to show you a few things. We'll look at the Ardens screening options. I'll show you how you can do it within the record as we are here. We'll also go and look at some of the PCN DES reports and other reports that we've got built in the system as well, to see who's had screening, who hasn't, and lots of other things around that. So we'll look at that in this session. I'm also going to take you through some of the consultation area of Ardens as well, and how you can use that more effectively, especially when you want to use like a symptoms analyzer and look at possible conditions that patients might have following NG12 guidance. So I'll go through the options that you've got available for you to use whilst you're dealing with patients as well. I think also it is worth noting that you know cancer care reviews can be done through here as well, and I'll prompt you or show you how that can be done and how you can access templates to do that too. And at the end we'll go through the reporting resources that we've got. We've got loads of cancer condition reports and the NG12 alerts that I'm going to go through with you as well. And PCN DES reports will be in there as well. So going through those with you too, and where you can find work that you've done and work to do, and looking at low uptake groups for screening alerts and things like that. So that's what I plan to show you. So I'll start off by just talking about some of the screenings. Now, I will go through the reports and that later on, and what you can do with all the different screening reports that are available. But when you're in the record and in lots of variety of different templates, you'll have the opportunity to go in to see, you know, to do work on screening if you wanted to capture any data to give to the patients or anything like that. So you'll find it on many screens like our cervical screening template and so on, but you can also find it under auto consultation. So for those of you that maybe not as familiar, the auto consultation button on SystmOne allows you to go into to an index of Ardens resources that are available for you to use, and I'll be dipping in and out some of these in this session. But what you'll notice under the Ardens screening is there's the opportunity to look at lots of different screening options that you might want to do, including your bowel, breast and cervical in there, and some others that you may find useful too. If I was to go into the cervical screening templates, you will have the guidance on here that you can see at the top. You'll have your advice codes in there. You'll notice stars on the Ardens templates as well. You'll see blue stars and red stars, and you may see some yellow stars as well. So the blue stars are basically any kind of based on national reports. So obviously the advice code there for the screening program is there with a blue star. The red star will be QOF. So any kind of codes that would be QOF related, you'll see a red star next to them. There's some exception codes there, as you can clearly see, but they're there in this occasion. And the yellow stars would be any local enhanced services work. There isn't anything in particular on this particular template, but there may be on other ones that you go in and use on Ardens. You can also notice that you've got the ability to do any kind of DNA kind of messages that you can send out there. You could do some letters to send out as well, which you can do, or overdue letters. You've got the opportunity to do all of that whilst you're in the patient's record. You could do it in bulk as well, as you're probably aware of in SystmOne as well. These are all here for you to go in and send any kind of letters regarding this. I mean, obviously this is for a smear, so any DNAs that did happen, you could send them some communication there. You simply copy and paste what's in here if you wanted to, highlighting it, and then Control V to copy, and then you can click on the text message or an email and send it through to the patient. You can also do cease and defer up here too. So if you did want to say that you're giving them any kind of leaflets or notify PCSE or any kind of other things, you can do from there, following all the guidance that you'd expect to see, you know, for in this occasion, cervical screening templates. If I go into some of the other ones as well, if I went into the bowel cancer one, you can see you've got the opportunity here to record any fit tests if you wanted to. We've got a little fit template, which you see, again, you can get this in multitude of places. This is just one area which you can use it. You'll see me go into it in other ways as well. There's a nice fit template there that could be completed if need be, excuse me. You've got the blue stars there again for the key codes that would need to be added. You've also got the advice codes in here and invitation codes and outcome codes as well. So it all follows all the you know, the guidance that you would expect. These are looking at invites on here, so you can send them a text message inviting them for the bowel screening program, and the same with emails as well. You could also do a letter if you needed to at the bottom. And then the other one would be pretty much the same. So if I went into breast cancer, again, it's a similar kind of layout with the criteria at the top, the recording of the code and the work you want to do with that, and then obviously you can do SMSs and emails from there individually if you wanted to. I'll show you where the reports are later on as well, so you can get a hang of those as well, because I think those are quite useful to also run too, but they're buried underneath a lot of the other stuff that you would also find really useful too. So if I do all that at the same time, it will make more sense to you as you see it being used. So those are the I suppose the Ardens screening and alerts, or the screenings that you have. You may also see some alerts if they are due a cancer screening. This patient doesn't, but you may also see some alerts on the patient status alert. So I think it's like a little red exclamation marks, which you may also find on some patients as well when you hover over it, but you've got those on there.